You know, there's an often used outlook on life that if you don't like your situation, change it. And if you can't, well, change your attitude. And I know that's a butchered version of the Maya Angelou quote, but as an added amendment to that quote, if you can't change your situation, change your location. And we've seen a lot of that mentality the last couple of years when it comes to COVID and, of course, masks. And now with Idaho and abortion laws. We know a lot of people are already traveling outside the Gem State for abortion accessibility. But does it stop there? A recent letter from the University of Idaho says no U of I staff can promote services for abortion or even contraceptives for the purpose of preventing a pregnancy. And that's while they're on the job, of course, not at any time on their own. But it's a good time to bring in Andrew Bartline here to kind of explain this a little bit, because we were talking about this and you've been searching all day looking for answers on how this might apply going through this week. How will this impact Idahoans and students at the University of Idaho? You can't talk about abortion, can't suggest abortion, and we're not even going to offer contraceptives.
Yeah, and it's important to know that the laws didn't exactly change. It's how the University of Idaho is interpreting these laws and, of course, advising their staff how to handle that. So first and foremost, we'll get that out of the way off the top, interpretation of the laws. And it starts with the No Public Funds for Abortion Act that was passed in 2021. It says no public dollars can promote, fund, or refer somebody to go get an abortion. The letter also says to university staff they should not advertise or promote services for the prevention of conception. That's just a fancy way of saying don't provide access to birth control. Now, the university arrives at that conclusion based on an unclear wording in State Code 18603. Brian touched on that earlier this week. In that code, it says other than a licensed physician, it's illegal to provide the prevention of conception. So the University of Idaho is advising staff to be cautious and be conservative based on their own interpretation to avoid any legal trouble. They warn staff breaking these rules could be a felony. So what does this impact? The first thing you'll probably think about is the health clinic on the campus at U of I, the Vandal Health Clinic. It provides different forms of contraceptives, but they say that they will not change even after this letter. Gritman Medical Center is contracted by the university to run that clinic. Gritman released a statement reading in part, "The methods in which we provide health care services to students and others at our Vandal Health Clinic will continue to comply with all state and federal laws and will not change as a result of the memo sent out recently by the University of Idaho's leadership." According to Gritman's statement, it does appear the law does either not apply to them because they're independently contracted after all, or at the very least, Gritman is choosing to interpret the language of these laws differently for themselves. Gritman will continue to offer their regular services at that Vandal Health Clinic. As for university staff, the letter warns about remaining neutral in classroom discussions about abortion and forms of contraceptives. Interestingly enough, the letter says staff can refer students to people and sources outside the university. On page 6 of that letter, it says, quote, directing students to private groups or agencies of another state where students can receive a discussion of all aspects of the topic and be presented with all alternatives legally available to them is not barred. However, in doing so, university employees must remain neutral on the subject of abortion and simply reference the ability of the outside sources to have a broader discussion of all aspects of the topic. But it appears that many people have already found these sources themselves, most namely at Planned Parenthood in Pullman, Washington. It's around 7 miles from Moscow.
A steady increase in patients from Idaho at the Pullman Clinic, especially this summer, where from July to August, we saw about a 62% up to 78% patient increase, and that has continued to rise over the last year.
Now, that timeline, Brian, is probably not a coincidence, talking about June and July when Roe was struck down. So whether people needed to or not, because it took time for the trigger laws in Idaho to kick in, people, of course, that gut reaction going out of state for whatever resources they would want to get. But it seems that at this health clinic on campus, though, it's kind of the same thing, where right now it seems like it's fine, nothing's going to change.
Well, what's interesting, 62 to 78% of what number we don't know. I mean, that could be, you know, of 5% or of 10 people that showed up, so it could be a small number there. The other thing, you said it was a fancy way of saying birth control, this prevention of conception. It's also an 1887 way of saying no birth control, because that law is word for word from 1972. It was also from 1887. The other thing I wanted to ask you about, or just kind of point out, so we've been talking about how, and you hear the headlines say, University of Idaho will not be providing birth control to students. And so basically what we found out is, well, unless professors were handing it out themselves, it's coming from the health center, which was providing that and will continue to do so.
Yeah, I mean, the headline will say one thing based on this letter and warning their staff, but the people who run that clinic are independently contracted,
Right.
and nothing is really going to change at that clinic, according to what we've heard so far from them.
Okay, good way to clear that up. All right, thank you very much, Andrew.